we always think that the old people have more risk and young people generally came out. Let me discuss you with our second case, that a young girl with depression attempted suicide and drank acid at home and came with corrosive injuries. Esophagus and stomach was damaged. So initially, of course, she was insulted feeding tube, managed conservatively. She healed fine, but developed the stomach stricture as well as esophageal stricture. Esophageal stricture managed with endoscopic dilatation. Initially, it was successful. Pyloric structure, of course, generally the pyloric structure are very difficult to manage endoscopically. So we did the gastrogenostomy where the stomach was added to the small intestine. 2 months patient felt well, but her depression bout continued. His suicidal tendency continued even after treatment. Started eating again, but after some time, and endoscopic treatment has a very high chance of recurrent stricture rate or endoscopy failure rate. She again developed dysphagia, vomiting, and on endoscopy, it was a very hard, tight stricture and not able to treat endoscopy any further. So we had to do a colon pull-up. Again, surgery was an eventful, extubated. This patient was doing well, but was refusing pulmonary physiotherapy and all our rehabilitation and aggressive measures to pump up her chest. Patient was flatly refusing, was not at all cooperative patient. So again, on day 2, in spite of warning that if you don't follow, you may develop this, but somehow due to her suicidal tendency, patient was not responding to our treatment and developed type 2 respiratory failure and CO2 retention. Patient kept on ventilator despite being young girl. Ultimately, the multi-organ failure ensued and patient died. So, at the end of this brief presentation, I just want to end with the summary that complications are very common after esophagectomy. Always look at the risk-benefit ratio for offering surgery. If you balance well, then like first patient and 95% of the patient recovers like first patient and even without pulmonary complication, but still you can have a very healthy life. But your skill to manage the complication and at the end of the patient compliance is the key. Thank you very much.